Good morning. My name is Dr. Toni Bark. I'm a licensed MD in the state of Illinois. I trained in pediatrics and rehab medicine, and I ran an emergency room, pediatric emergency room in the inner city. And during that time, I witnessed several children, after being in the vaccine clinic, coming to the emergency room in status epilepticus with asthma, even respiratory arrest. That was a while ago. Since that time, we've had an emerging field called epigenetics, which is the field of looking at the link between genetics and environmental toxins affecting people individually. Vaccines are not safe and effective for everyone. This cannot be a one-size-fits-all. Not everyone has the same risk factors. But in the last 20 to 30 years, we have elucidated some things that are known as risk factors, and they're called single nucleotide polymorphic variants. And these interface with things like drugs and vaccines very differently for different people. And this is not a 1 in a million type of issue. So there can be maybe up to 10 to 15% of people that are quite susceptible to different vaccines. And these are a minority, a susceptible minority, who are being left out in the rain without an umbrella. So while it sounds good and well that vaccines are safe and effective, just so you understand that they are legally classified as unavoidably unsafe, and the manufacturers are not liable. This is a liability-free product that is being mandated on children who have epigenetic susceptibility to injury, and the injuries are serious, including death and chronic encephalopathies. And while there's only been 2 deaths from measles in this country since 2003, there's been at least 400 and some odd children who've died from the vaccine. And according to Gregory Poland, who is a vaccinologist at Mayo Clinic, he has written an article called The Paradox of Measles, which states that you cannot eradicate a virus like measles with a live viral vaccine. You also will see that the majority of outbreaks, and while it is different in this community because you've got a tight community of unvaccinated people where this measles outbreak is happening, but the majority of measles cases around the country are actually in the vaccinated. So this is a complex picture. It's not one-sided. There's a lot of gray areas. It's very complex. The last panel would have you believe that it's not complex, that vaccines are safe and effective, and the vaccine prevents measles, and that if everyone's vaccinated, there won't be measles, and that is not true. The largest outbreak that New York City has ever seen was just a few years ago, and it was started by a 22-year-old recent recipient of an MMR booster. And 35 to 40 people who had all been vaccinated got a vaccine strain measles. In Corpus Christi in 1983, there were over 400 students who had all been vaccinated, 98% vaccination rates, 97% of which had antibodies, memory antibodies, and they still got measles. This is not a clear black and white picture. And if you eliminate exemptions, we all know how difficult medical exemptions are because the requirements for medical exemptions are lagging about 30 years behind the science of the epigenetic risk factors. So if you eliminate these exemptions, you are basically making a large minority of people susceptible to very serious risks, including death. Thank you.
And we must have made such an impression that they had to ix that second panel. What are they afraid of? They're afraid of the truth. Now, I'm not saying that everybody in there was consciously lying, but somebody knows the truth on that other side, and they're lying, and there's many followers who don't want to know the truth. Because if they knew the truth, their cushy lifestyle, the way they make money, what they're doing, they'd have to think about it. They'd have to think about it, and they'd have to do something about it if they had a moral compass. So I'm not implying that everybody in there was lying, but there's somebody who knows the truth on the other side, and they're giving you false information. As you all know, it was the folks in there who don't necessarily know what's false. You have to stay on this. You have to go to your reps, your local representatives, and you have to start there. You have to educate your local representatives. You have to tell the people not to tolerate being coerced into doing a medical procedure that comes with a risk of death and injury, with a product that is liability-free. I mean, this is absolute insanity. And everyone's thanking me, you're welcome. But let me tell you, I didn't just do this for you. I did this for me too, and everyone else. It starts here, and it goes through the rest of the country. Washington is ground zero today. California was ground zero in 2014. This is a wave. This is a concerted, planned propaganda wave. How convenient that CNN had an article this week that said 120,000 people died of measles worldwide. In 2017, there were only 130,000 cases of measles in 2017. Are they telling me that everybody who got measles that year dropped dead? So now it's Ebola, and there were no stats associated with that. And how convenient it came out 2 days before today. And what's going on in Colorado today. If you think this isn't planned by the pharma lobbyists, by your state health department, which is an out-pocket, it's an offshoot of the propaganda machine for Merck and Glaxo and our own CDC, because they've been captured. Unfortunately, the state health departments are filled with people who really are ignorant. They don't know the reality. I've spoken with some of them, not here, but in some of the other states, and they're really clueless. They have no idea that there's outbreaks from vaccine strain measles. They have no idea that there's outbreaks in fully vaccinated populations with antibody responses, memory antibodies. How do you not know this if you're mandating these things? How do you not try to understand what's going on? It is not an easy thing to understand. There's some science, there's statistics. Statistics are easily manipulated. But if this is your job and this is what you're doing day in and day out, and you're being paid by the public, you have an obligation to educate yourself. We had 3 minutes apiece in there. 3 minutes apiece. How many minutes did they spend with pharma lobbyists? You can bet it was more than 3 minutes. Thousands of hours. So please.
Thousands of dollars!
And thousands of dollars, yes. So, they're worried about the few, and if you notice, they all have the same talking points. It was all the same talking points. For the few people that are immunocompromised and all the people who have cancer. Why do so many kids have cancer? Why are so many kids immunocompromised? What the fuck is going on there? I was just informed there will be no more F-bombs. Okay. What is going on that everyone has cancer and immunosuppression? Why? How is that evolutionarily advantageous? This doesn't happen. This happens because we're doing something wrong. Right? And that's a question they didn't even want to ask themselves. It's ridiculous. So stay on your reps. You've got to educate, start from the bottom, make sure they hear you. The local government, very, very local. Start close. Regional health districts. Good luck with that one. Regional health districts. I don't know about that. But you got to start local, and you need to stay on it. We can't sleep. This is a war that we're fighting, and this is worldwide. This is global. This is Dr. Evil we're up against. It's medical tyranny run by the pharmaceutical industry and the food industry to some degree, and they have so much money that we're really up against Goliath. We have to stay on it. Yes, and no liability. Money, all the money, and no liability. And all we have is truth and foot soldiers on the ground. So stay with it.